Hello and welcome to Labour Lens. I am Sharon Ijasol. On this week edition of the program, we're focusing on the healthcare sector and its workers. We will be right back.
The two-week protest strike by members of the Academic Staff Union of Polytechnics started on Monday. It was declared after its emergency National Executive Council meeting held last Wednesday. The ASUP National Chairman, Anderson Ezeibe, told members of the union at the Federal Polytechnic of Kwara State that the government is yet to honor the memorandum of action it signed with the union.
3 months is ample enough time to fulfill these processes. That 3 months period expired on the 10th of September 2021. And this is 7 months after the 3 months period. Those items remain unfulfilled. Well, like you've already pointed out, we are on a 2 weeks warning strike. This is a protest. We don't even call it a strike, so to speak. We are withdrawing our services in protest.
The strike is premised on non-release of the approved 15 billion naira revitalization fund for Nigerian polytechnics and colleges of education and non-release of 10 months arrears of the new minimum wage. Others include review of polytechnic education standard and bad conditions of service of members. The union is demanding that the government honors the agreement it signed with the union.
This period is not a period for discussion with officials of the government. What it demands is action. What we signed was a memorandum of action. What we are demanding for is action. Action in the direction of fulfillment of the items in that same memorandum of action.
At the expiration of the ongoing protest strike, the National Executive Council of the union is expected to meet and determine the next line of action for members.
In the early hours of Thursday, students were seen in their numbers at the popular Fajiri roundabout in Ado-Ekiti, armed with various placards. They blocked the major route from different axes of the town, including the Ekiti State Government House, condemning the unending strike embarked upon by university lecturers.
The purpose of that is because we felt we have a government who does not listen to the yearnings of Nigerian students, particularly that the interest of Nigerian students is not more their interest, rather their interest is political activities. At the end of every strike, the lecturer will get paid. At the end of every strike, the government official will get paid. Then who pay for the Nigerian student? Who pay for the time being wasted by Nigerian students? Nobody.
The NANS president reiterated the resolve of the student body to halt all political activities if the industrial action persists, lamenting the unconcerned attitude of government to education.
Mind you, there is a statement by us, and we are not joking with that statement, that if this matter is not being resolved, they should forget about the political activities, the primary coming up in Abuja anytime soon. The governor, Dr. Donka Odefayemi, who is the chairman of the Governor Forum, to call a emergency meeting of the governors to find solution to this matter.
Students who converged for the protest are from the Ekiti State University, Federal University Oye-Ekiti, and student union representatives.
There are a series of strikes which is currently undergoing by different type of unions and associations. I can say it without mixing words that most of the causes of this strike is from the government side, because once agreement has been signed, I think the labor leaders need to hear the positive response from the government. But government at times, they will sign the agreement, they will negotiate, bargain and sign the agreement, but at the end of it, they will neglect all the agreement as well as the signing. So we decided to give government more time, as I said, because we believe that as a health professionals or as a people who are dealing with human life, we don't have any avenue rather than our people. Our first priority is the patient, our second priority is the patient, and our third priority is the patient. But that will not deter us. Maybe when it's come to real action, maybe if government decided not to reasons, as well as to see more opportunity given to it by the health care industries union and the association, then we don't have any alternative rather than to go back to our strike. So I think we decided to give government more time just for it to think that yes, we are very, very responsible Nigerians and we don't have anything, nowhere to go than Nigeria, and we have the people at our heart. That's why we are given this ample opportunity for government to see reason as well as to address our issue.
Health workers are faced with insecurity. In the system right now, there are many of our health workers, nurses and midwives in the den of kidnappers, bandits. They are not secured in their places of work. Government need to do something about insecurity in the country. Many of them are being battered and assaulted by patients and their relatives. So something need to be done to secure them, because as we uphold the patient bill of rights, health workers also have rights. Right to dignity and respect. They have right to conducive and healthy environment to work. Right to remuneration, adequate remuneration and welfare package for them. So all this, if it's been put in place for health workers, nurses and midwives, they will be happy. They will be happy to discharge their duty and put in their best. I just want to appeal to the government to see need to come into the aids of health workers. The workload is so much on us, and the hazard allowance of 5,000, something need to be done as quickly as possible so as to calm the nerves of health workers in the system.
On the profile interview segment this week, I'll be speaking with the National President of the Medical and Health Workers Union of Nigeria. He brought us up to speed about the challenges workers are faced with in the country, the urgent need for infrastructure in the hospitals to be upgraded, and the need for decent work to be promoted in the sector. Royal Majesty, it's good to have you on the program.
It's a pleasure after a long time.
Very long time. Very long time. A lot has happened in the healthcare sector since the last time we discussed. And I know that there was a time that not just medical workers, also we had the other body again that was also clamoring for strike, even though it was suspended at the time. Can you bring us up to speed with the development with government as regards your demands? Would you say your demands has been met at this point in time?
Thank you very much for this is a loaded question, but I'll try the best I can to really simplify it. First and foremost, if you're asking if government has met our demands, that is capital no. On trust, we suspended our action last year, basically because the president himself appealed to the joint health sector unions, to which I am the national chairman. And at that point in time again, I haven't been anointed as, installed as Royal Majesty. I felt I need to think more elderly, and I persuaded my people, pleaded with them. Even though some were very skeptical that the government will turn us down, they will not keep their promise. I used my elderly position to impress on my members and convince my members. And we were also, of course, Mr. President has appealed. Let's give him a try. Let's accept what he has said. And since he said he's going to deal with our issues, 16 issues that we now abridged and reduced to 5 major issues. And since the president has promised he will do that for the sake of COVID and for Nigerians and for himself, we should not embark on the strike. We heeded to that call. That's last year. But from that time to this moment, as I speak with you, I'll say none of the agreed, which he promised, the agreed things have been implemented. So it's an issue of now throwing away the trust. And I'm afraid if any day we choose to go the battle way, to toe the battle line, and the government comes to make an appeal, I'm afraid my members would accept that appeal. Because as we speak, I told you, just yesterday, I have not confirmed that I was told only April, out of the April, May, that is, the president said he wants to pay, has been paid.
That was as a result of the strike that was embarked about 2-3 years ago.
Yeah, 2018.
No pay, no work.
No work, no pay thing, 2018. No pay. In the first place, we ought not to have been punished because the things we decried then were exposed by COVID. So rather than saying we are giving you a compassionate approval or anything, they would have rather said we apologize to you because the things you cried out for, that we punished you for, have been proven. So come and take your money. But that did not happen, but it took the president himself to compassionately grant that release of the April, May. There are still others that are still held, but let's talk about one. So, but from that December to now, even when December, that the president said it should be paid before December ending, these monies were not paid to us. Even people who went on strike, defying the president's order, were paid. But for GSU members who were not paid, maybe they just want to test our abilities to fight. But every time, as I speak, every time we put Nigerians first, that's why we have not.
Talking about the salary adjustment coins structure, what's been the updates coupled with the issue of inflation in the country at the moment? How have your members been coping? Can you juxtapose this with that the amount of money workers are receiving with that of the doctors, which are counterparts in the healthcare sector?
Let me tell you in truth. Nigeria, I think no government is ready to make Nigeria work. First and foremost, if you don't pay the working class well, then that is the basic thing you need to do to reduce corruption. The moment workers are paid well and they feel that there is value in these earnings, it will be difficult for anybody to come and tell them to indulge themselves in any shady practice. Because they know with a good pay, their end points, retirement benefits, will also be significant. But here, government does something. Inflation may have taken off the previous salary. Inflation may have outgrown the previous salary maybe by 2,000%. Then when they want to increase, they come and increase maybe 30% or 50%. How will that solve the problem? How will that assuage the people of their pains? It's not possible. It can't assuage them. So what we are trying to say is this. Like the salary adjustments, that was something that would have been done since 2014. And they have not done it. You can see that from 2014 to now, the inflationary trend has actually, outsmarted that for many, many, many times over. So we are expecting, because that is one of the major conditions. Yes, the government, I want to be fair to the government at this point, part of the government. There are the government agencies that we are really bent on ensuring that this adjustment was done because we merited it. the Incomes and Wages Commission, which was saddled with the responsibility to working out those things, they were committed to the fact. Every other person, except Federal Ministry of Health, that rather than being a neutral, unbiased manager of this health system, umpire of the system, they rather made themselves what we have been asking this government not to do. They confirmed what we have been decrying, that on no account should any government in this country employ the minister of state, and sometime before, even the permanent secretary, from one micro sector of the service deliverers in the health system. Once the president has put only that sector of people in the management of the health system, he will only hear from that sector. So you won't be able to get balanced information from all sectors to actually administer the health system appropriately. So that's it's part of the bane that has kept the health system driving down. We will still stand, and today I want to really make it very vehemently that the only way that Nigerian health system can be saved, first step, let's put round pegs in round holes, or square pegs in square holes. Hospital administrators. The administration of the hospital should not be left in the hands of one particular profession that has actually, seen itself as the merchant of chauvinism. If we want the health system to work, let's copy what happens. When it comes to there, international best practice is thrown overboard. So if Nigeria wants to move forward, but like we used to be before, when hospital administrators were administering the hospitals, we were better. If for over 30 years we have done the same thing and we're not getting better, the public health institutions are not getting better. The public health institutions that are the cheapest place where Nigerians can really get, the poor Nigerians or masses can get health care, are not getting better, then we must have to change the way.
Okay, so very quickly, the issue in the healthcare sector is very peculiar, and there have been reports about the infrastructure put in place and how it can be better. Would you say the government's policy towards improving the healthcare sector is sufficient in terms of ensuring that the infrastructure apparatus work?
Certainly the infrastructure is not anything to really write home. Even before this government. Yes, maybe there have been some half-hearted interventions here and there. But what we are saying is this. Just like the TED fund was provided for the education sector, I'm not saying that has solved the problems, because there are lots of untoward issues there. If they can also set up a special fund for the health sector, I think that will go a long way. But it should be managed with honesty, not to be given to one section or small sector of the health system that is merchants of chauvinism, bias to the highest extent. No. Doing that, you won't help the situation. I still want to say that we have hope that the health system can be better. It is the very health professionals in Nigeria that are not well treated that move across the shores of this country, and they are performing well up there, out there. So we have the skills.
And you talk about brain drain, because we have many of our medical doctors, nurses, and other health workers move across the country. There are some states whereby there are some certain professionals that you can't find anymore. How would you react to this?
That is the problem. If we want to really get health service to the poor masses and to the growing Nigerian population. Is it not ironical that the Nigerian population is growing, okay, maybe at jet speed, and then the health development in terms of personnel, employment in the health system, and the establishment of structures is growing at a snail speed. When will they meet? Maybe people don't know how important health system is. Let me end up by taking this on the lighter side, a joke. I went somewhere and everybody was talking about his own profession. That his profession is the most important and then the profession is the first. People in your sector, the media people said their profession was the first because God created the world with his spoken word. And so they were first. The agric people, the agrarians said theirs was first because Adam and Eve started farming in Garden of Eden. And then I told them that the health service was the first profession. And everyone said, how? I said, well, health is there to provide health for the people, to keep people healthy. So I do know that the God that spoke on that day to create the world, and the God that created the Garden of Eden to allow Adam and Eve to farm there was a healthy God.
There's this concern about the ratio of patients to that of health workers. Many health workers are overburdened. They need to work with the patient and they have a lot of people to attend to at the same time. What do you think needs to be done to ensure that we have the right number of ratio of workers?
Employment, training and retraining, that is the key. Yes, government would say, like everybody would say, oh, there's no money. There's no money in the country, and so government cannot afford to employ. But I want to ask, has there been any government that ruled and left, and then we have not discovered billions and trillions of allegedly stolen money or embezzled money? So, that's why I don't believe in this saying that government cannot pay workers well. The money, the resources are there. But because the resources are not prioritized into the areas that they should have been used for, the bulk stays for people to pinch. And then when the opportunity comes and they leave the office, then people start talking. Oh, XX billions have been stolen. Oh, XX trillions have been stolen. Oh, maybe a python has swallowed something. And all that. You see? So you will agree with me that the money expended or the money embezzled or that is frittered away through these shady ways is 1,000,000 times more than what is needed to implement, to pay health workers properly, all right? To pay the working class of Nigeria properly, to provide health, the infrastructure for health properly, so as to stem the brain drain that our people are running away from this country too. So I sometimes I don't want to believe that God has decided to punish us. I don't think we are the worst offenders of God. But the things, the way they happen, you will advise, the advice will not be taken. Look at the huge money that they are using to sell forms. ASU is on strike. Our children are away from school. Though the children of the poor, like us, are out of school. But people are falling over each other to use maybe 100 million, 50 or 200 million, just to buy form to contest election. Are the politicians not Nigerians? Are they not drawing the monies from the same federal posts that the civil servants are also drawing their salaries? So with the political appointments they have, if they can afford to buy form for 100 million naira, what does it take to get our university lecturers back to work and our children back to school? It's annoying. But let me, before they say I am now kind of trespassing into an area that I don't have the power of attorney to speak, I would want to say that there's a lot that needs to be done.
And that's all we can take on today's edition of the program. Join us next week for a fresh edition of the show. I am Sharon Ijason. Thanks for watching, and remember that labor creates wealth.